The EEOC issued a declaration that implements what's called the Pregnant Workers Fairness Act. And this act actually started with good intentions. It was this idea that employers with 15 or more employees should accommodate female employees in regards to pregnancy and childbirth. We're all for that. In fact, we at Public Square give a baby bonus to new parents, $5,000 after taxes, because we support the expansion of families. Here's the problem. The EEOC bureaucracy has now essentially expanded this employer accommodation mandate to include female employees seeking abortion. So it used to be about ensuring that women could act on their desire to both have a career and to be a devoted mother. And that included paid time off that was set within certain standards. But now the EEOC has said, yeah, that Pregnancy Workers Fairness Act that was a law, we're going to interpret it with a different definition of what being fair means, and we're going to include abortion. And if you do not, we will penalize either the health insurance provider or the company. And then the HHS took it even further. They issued on April 25th of 2024 a new regulation interpreting Section 1557 of the Affordable Care Act. This section forbids discrimination in health programs in regard to sex. So it says that a health insurance provider or a company that is utilizing a health care plan, whether self-funded or a group plan, it was intended to say that you can't discriminate based upon sex, which means male or female. But the HHS said, no, that's not enough. We are going to reinterpret the definition of sex in the Affordable Care Act to mean and include termination of pregnancy and imposing with that a surgical and chemical abortion health care plan coverage mandate along with gender-affirming care in their health care plans, which means that if we as an employer or if our healthcare provider that we utilize for all of our employee plans refuses to offer puberty blockers, cross-sex hormones, top and bottom surgeries, gender-conforming cosmetic surgery, and a host of other affirming practices paid for by the employer, that we are in violation of the Affordable Care Act as interpreted by the HHS. So they're essentially going around the law to reinterpret to harm our companies.